It's been a very active respiratory virus season here in Canada this winter, and it's showing no signs of slowing down. While some data shows we may be past the peak, we're still seeing a significant number of cases of the flu, RSV, and COVID-19. For a closer look at where we are during this viral season, I'm joined now by CTV Medical Expert Dr. Marla Shapiro. Dr. Marla, thanks for being here. How would you describe this respiratory season so far?
So when we look at our numbers are about at where we would expect them to see. But remember, we already have an overtaxed medical system, so any bump up taxes us even more. And if we look across the country, basically it's an evolving picture. What I tell you today may be different next week. For example, if we look across the country right now, for example, in BC, a lot of respiratory viruses, a lot of flu. Alberta was slammed with flu. In Ontario, we're seeing a lot of RSV. But remember, this is really a fluid picture, and all three are co-circulating at the present time.
All right, now let's remind people about the symptoms of the flu, RSV, and COVID, and how do you tell them apart?
You know, sometimes it's really difficult to tell them apart because there is overlap. When we look at the flu, typically we think of that as coming on really suddenly with a high fever. Body aches are really that landmark sign that we see, the chills, fatigue, that typically goes along with it. When we move on from flu, for example, to let's say RSV, that's a little bit different. Wheezing is more of a picture that we typically see, but again, the same coughing and sneezing can start like a cold. It's most serious in the very young, under 2, babies under 6 months, individuals over the age of 60, and those who have other illnesses, like if you have a respiratory chronic obstructive lung disease, or you're an asthmatic or a cardiac patient, you're a patient who's at high risk. And then when we look at COVID right now, it varies. That loss of sense of taste and smell, which was so prevalent at the beginning, sometimes yes, sometimes no. We're seeing a scratchy throat. It may look like a common cold, but it's often very difficult to detect. And one of the things that we're seeing with the home COVID testing is that it's taking longer to turn positive. So I'm telling my patients, if you think that you might have COVID and you test negative, test again, test again, test again, at least 2-3 days in a row, so you know whether or not you've had it. And certainly for any of these respiratory illnesses, mask up and stay away from people. Don't share it with anybody else.
How are we doing when it comes to vaccinations?
We're not doing well. And it really is unfortunate because this year we have a vaccine for flu that's a really good match. And we look at the overall across Canada, over the age of 60, not bad, but the general rate about 15%. To 1 in 4 max. If we look at what's happening in COVID, really there's been very little uptake in terms of the boosters across the country. And again, the present vaccine that we have is effective against all the variants that we see circulating, including the newer variant JN1. So really important to do what you can. I know everybody's tired about vaccines, but given the fact that you can get more than one illness at a time, and it really makes a difference what you have in terms of treatment, prevention remains the key.
All right, and we are also tracking a Canada-wide surge in cases of strep A. Today, health officials in BC say the deaths of 4 children are being linked to this invasive form of strep. What do people need to know about the spread of strep this year, and what can they do to identify it?
In these 4 children that you're talking about, they also had coexisting at the same time, either flu or a respiratory-like illness, which really tells you how important it is to try and prevent what you can prevent. All children over the age of 6 months can get a flu shot. The group that's at the highest risk for not just strep, but invasive strep, and that's what we're really concerned about, infants and young children, pregnant people, adults over the age of 65, immune compromised. This should sound familiar to you in terms of who's at the greatest risk for COVID as well. People who experience homelessness, individuals with a recent viral infection. The key message is that sore throat may be common to all of these respiratory illnesses, but a severe sore throat should not go ignored. We can do a strep screen in the office as a simple throat swab. There's effective antibiotics for it. So if throat is a predominant symptom as opposed to, let's say, sniffles and a cold, that really painful throat should get swabbed.
All right, a really important message to get out there. CTV Medical Expert Dr. Marla Shapiro, we thank you for your time today.
See you the next time.